Welcome, everyone. We are really thrilled to have you here today for our Columbia CTSA Implementation Science Initiative seminar series. I am so thrilled to have my longtime colleague, Dr. Juliet Iwelunmor. I hope I said that right. Is that good? Okay, perfect. Good. um, Juliet is just an amazing researcher and scholar and implementation scientist. We're really thrilled to have her. She is a professor of medicine and associate director for a global health and dissemination center at Washington University School of Medicine. She is such a passionate advocate for issues of both health equity and sustainability. She has done so much work on really thinking about participatory research and this intersection with implementation and sustainability, particularly with the dissemination of health information that amplifies the voices of youth in health interventions. And she's done this work globally across a range of settings. I know she's coming to us today from Nigeria.
That's
She
Nigeria.
And
Mhm.
prior to her position at Washington University, she served as a professor at St. Louis University as well. And has just, I think has been really an inspiration in this work. And I'm really thrilled to have gotten to collaborate with her over the last couple of years and in future years. She's now one of the MPIs for a new U54 center that I think she'll be talking about as well as part of the Global Implementation Science consortium that's funded through NCI. And we have one of these U54s as well through Columbia. So we are excited about the opportunity to collaborate with her in future years. So please join me in welcoming Juliet. Thanks so much.
Thank you. I find myself in Lagos, Nigeria, for example, right now, because there's an omniverse event happening where I met people from the music world, the tech world, the health world, just coming together in this omniverse, right, to have a conversation. And the whole week I've been saying, all creativity is local. So yes, you have your local music, your local food, your local fashion. And why is all health not local? Why are we not really invested in, really a hyper local, real world interventions that really then connects and centers people in the way music has been doing for ages and the ways food has been doing for ages. And so this journey, they say a 100-day journey begins with a day, has been a journey of a lifetime, a journey that I don't think there's always going to be a complete answer. It's still a learning process. I think anyone invested in trying to sustain evidence-based interventions in settings that are actually rich in resources. So I try not to say limited anymore because I'm in the land of Afrobeat music. There's so much resources here and assets worth amplifying for health that we often don't do because we take Western ideas of what health should be and sort of transport them. But there are opportunities to take local interventions and then use that for health. And I'm here. I've been talking about our mother-daughter intervention, for example, which is the access grant, for example, funded by NCI, that is letting us do things like having mothers and daughters communicate about HPV vaccination and HPV screening. It's natural, it's local, it's happening here. And so those are some of the things we do in the work that I do in terms of sustaining evidence-based interventions, that there are evidence that do exist, but oftentimes they're not connecting to people. And they're also not connecting to people using tools that make sense to people. And then if you do bring those evidence, ultimately the last mile is that it remains, right? Ultimately, the last mile is that you sustain them, it lasts. And so I want to sort of take you through our journey that didn't begin today. I still don't have all the answers, but I look forward to learning from you all too that may have experience with trying to sustain your evidence-based work. And then hopefully we can have a mutual reciprocal learning along the way that continues to bring more energy and more vitality, more resourcefulness, and even resilience to this work of wanting to do sustainability, not as the tail end of your work, but truly beginning from the beginning with the end in mind as a vital outcome that people can study in the way they study adoption or implementation or even effectiveness. Sustainability is a vital outcome and it can be studied from the beginning. And so hopefully this talk will let you begin to have a plan in terms of how you do it. And so all protocols observed. Thank you for listening, and let's go. So in terms of the outline, and try to make it simple, and give a sense of a historical context. The outline is going to give you a sense of the hurdles, along the way, the opportunities for sustaining. I'm going to give a sense of a case study, in terms of some of the work we've been doing using what we call planning. If you've read the work, by Jeffrey Curran, where he talks about implementation science made simple, a bunch of us have been thinking, well, how do we even begin to make sustainability simple? And truly, it begins with a plan. My people perish for a lack of vision. It truly, if you want to get to the bottom of sustainability, you ought to have a plan. And I'm going to share examples from here in Nigeria and begin to tell you sort of our next steps and future directions. So how do we last? Implementation science is connected, or if you're interested in this field, what we want to do is close the gap between research and practice. And oftentimes when people talk about the gap, it's almost like as if the gap is simple, right? It's just one line between research and practice. And somehow if you have some strategies or some tools or mechanisms, and boom, the gap will be closed. In reality, the gap is not simple. I think if you've dealt in any real world settings, like I find myself in Lagos, you're going to deal with electricity issues, you're going to deal with clean water issues. The gap is not as simple as just coming with your research. Somehow practice will pick it up, and boom, we've closed the gap. And I think it's important to start here, knowing that there'll be many, many things you're going to be doing to want to really throw that gap. And so one strategy or one tools might work in one setting, but may not work in the other setting, in another setting. And so how are you flexible? How are you willing to learn? How are you willing to adapt so that we truly get to the bottom of closing these gaps? And then the most important thing, and I love to cite this work by Marian Schreier, John Deeren, because yes, a lot of us are committed to making sure we do effectiveness research. And it's very important that your work is effective. But truly, why even bother with the work being effective if it's not going to remain, right? So why bother doing something around high blood pressure if you leave as if the communities or the people you've interacted with somehow poof, the high blood pressure is gone, or somehow poof, cancer is gone because you came for 5 years or 3 years. And so, and this is not from me, this is from Marian Schreier and John Deeren's work, and I'll share a little bit about that later. And this was the last line of her paper on gender sustainability, where she really asked the field. We've been, very involved with trying to make sure we do work that is effective, and it's important to do work that is effective. But of what use is effective work if it doesn't remain 3 years, 5 years, 10 years? And so, are there other fields we should be learning from in terms of how to really do work that lasts? And so then it begins with definitions. So, and a bunch of people have, tried to understand, well, how do you define this so that we get to a sense of the why even do it now, and then maybe why plan. And this definition is from Shidiak, Riskila, and Bone, and I'll share the paper as I move along, where they define sustainability as a continuation of intended health benefits, continuation of core program elements, and an adequate capacity then for that continuation. And then the question is, well, why even think about this, right? Why focus on sustainability from the beginning? Because a lot of us are focused on effectiveness, for example, and we do the work that is effective and we leave, but the disease remains or even reoccurs. And so it's like almost like an investment that is wasted, right? Where you've done all that work, you've left, but the issues remain. There's ethical concerns, right? Community concerns, and it's even diminished community support, where you build this ecosystem to do really great, effective work, and somehow you leave, and maybe the next group that wants to come back is going to have a hard time coming back because it already has a memory of before, right? Is it another one of your study? You've heard that, especially if you do community work, where many community members say, hey, you like those other people that are gonna come and fill out surveys and leave. We don't want that. And they have a right to do that because they know that that's all you get. They get to give you, and you publish your data and you leave as if the issues are gone. And then probably another one is return on investments. A lot of us are using grants, taxpayer funded work. And so it's important to understand that this work, we have to be paying attention to who's funding it and why they're funding it, and make sure that we're doing work that then leads to long-term benefit to justify why we're even being funded. And then when you think of why now, I think for the longest, we focused on the deficits, right? The challenges with sustainability, the challenges with a lot of issues, to the neglect of the assets, the neglect of, like I was saying, all creativity is local. Why is all healing not local? So there are already assets in many settings. Music, Afrobeat music is already common in Nigeria where I am right now. There's so many assets that we're not often using for health in such a way that would allow us to then create interventions that last. It would take partnerships. You know, I stepped out of my comfort zone and went and met musicians this week. I've been spending the whole week with musicians and tech startup people, and I'm at least learning from them the language of what it takes to last, right? A lot of musicians have been in their field for years and they studied what it means to build music and continue to engage their audience over the years, that maybe some of us health researchers ought to spend some time with musicians to understand how they build their platform over time. And that's what I'm trying to say, that oftentimes in many of the settings we find ourselves in, there are assets worth nurturing. And if only we build partnerships and understanding, then maybe we can get lessons that can be learned for lasting. Structural racism is now something everybody's paying attention to, because, you know, many settings, you know, are not having resources they need for the health. Climate change, the pandemic has opened, you know, our eyes up to the fact that it's not enough to just be the health expert if you're not going to be in communications with the community, because you can have a tool, a vaccine, and yet the community will not pick it up because you've not consistently been involved with working with the community over time. And then planning for it, you know, at the bare minimum, what we're asking people to do these days is plan. And you will see some of the data that I'll show where, despite even having all the resources, despite even saying they would do something around sustainability, most people don't even have a plan. And so at the bare minimum, if you leave here with nothing, please leave here with the fact that if you're going to do sustainability work, have a plan, have people, learn, be willing to change and nurture assets, because it matters for then the conditions you're going to put in place to last. And so I'm going to give some sense of, you know, historical systematic review to sort of guide us through how we got here. And one of my favorite papers by Thomas Buster, written in 1990. So all of us interested in doing work in sub-Saharan in Africa, Central America, you know, in the 1990s, he asked the question, are you able to do donor-supported health projects? And in such a way that it remains. And he would argue that economic, political, institutional context will make it hard to do this work. But if you begin with, you know, yes, the work is effective, but then there are defined goals and objectives we're going to use to then integrate the work into established structure. So there should be a fit, right? Yes, pay attention to funding. And if it's national and local, great, but make sure you have that fit, make sure you have funding, make sure you're also having clear, defined goals and objectives that are negotiated from the beginning in the design of your project in a mutual, respectful way. And then do that with capacity building. So don't just only bring all this stuff and then leave. Train people to be able to continue. And if you have all those parameters in place, just maybe you might get to a project that is sustainable. Another favorite of mine is Shetty Riskales and Bones paper, where they actually say plan, you know, plan for it. You know, so in other words, I'm not saying something new. In 1998, they argued that if you want to do, especially community-based work, you have to plan for its sustainability. Plan in such a way that you're paying attention to those health benefits, right? Plan in such a way that there's also a fit within an organization, a group. So don't just come haphazardly and say you want to do work without actually making sure there will be a fit with an organization that's already established and in the ground. And again, they argued for capacity building, you know, because in many of these settings, there'll be turnover. People will come and leave. But if you train people, hopefully the memories of those projects remain with the new sets of people that come on board. Another one is Marian Schreier. And I like to pause here often because Marian Schreier is no more with us, right? So she's late, but she was a program champion. I mean, she was a fierce program champion for, is sustainability possible? And she has so many literature that really wanted people that, you know, to push the envelope of what can be if people actually began from the point of view of sustainability. And so she would say local projects can last. Again, that focus on local, right? The local assets, you know, under the right conditions with internal and external supporting factors. they can last when you have things like a champion, right? When you are modifying, so adapting those projects over time. This fit thing keeps coming. So it's not enough to just bring a project and put it on the ground and assume that will be a fit. You want to build your project from the beginning with a fit with an organization, have staff people that you're also training and building them up and providing support. And if you do that, she would argue, and this was a 2005 paper, so you can only imagine if you do that, she would argue that sustainability is possible. Another favorite of mine then is her agenda for it, right? She really then expounded on that paper into the reasons to study it in this 2011 paper where she talked about the inputs, right? Intervent, we want to make sure we have the evidence that is effective, again, organizational capacity, partnerships, prior relationships, and then pay attention to characteristics, support, environmental, outer support. All of them then lead to sort of the client benefits, the community partnerships, policies, and things that allow you to ensure that work remains. Enola came with a group of expert panels back in 2015. And again, they too wanted to say, okay, we've been hearing this thing about sustainability. We think we know what it means, but again, what is the issue? Why is it that we don't have a clear agenda, a clear pipeline on how to do this work? And so the expert panel basically said we all need to have a unified agenda. We all need to advance methods. And again, they too say we need to plan for this. You need to be systematic in the way you do this work such that it's not something people consider at the tail end of the research. It's something they can begin with the end in mind from the beginning. And so it led to our own systematic review paper. We did this in 2016 now, where in Sub-Saharan Africa in particular, we took Shitya's Riskless definition and Bones definition and says, okay, if sustainability means continued health benefits, continued core capacity, continued capacity then to implement those elements, well, in the region that is Africa, what is that like? And we found 41 papers that have done some form of sustainability work, 26 of them, in 26 countries, Kenya and Nigeria being the highest. At that time, HIV was one of the conditions that everybody was trying to study in terms of how to, because it was a pressing health issue if you think of that period of time. So everybody was trying to think of how do you ensure that the programs you create around HIV remains. Very few of them used a form of a framework, but what came out of this paper was that ownership at the community level, mobilization of local champions were key facilitators that would ensure things last. And we also concluded then, at the bare minimum, have a plan. And so then, this is the literature that has been saying, do this work. What are some hurdles and even maybe potential opportunities that people can then use as they think through where do they even begin with sustainability work? I always preface this to say, anybody that's interested in doing work anywhere in the world, the truth of the matter is almost half of us will have work that will not last. So 50% of evidence-based interventions are never going to be sustained. Things like, research flaws, things like, we don't even publish the papers. We don't even have data that allows us to continue. 50% of us will just not have work that lasts. So that is a hurdle. Time is another hurdle. The fact that, it takes time to actually initiate the work, implement the work, get it to some use, right, in full or incomplete, and then study sustainability. Oftentimes, project life cycles are 5 years or maybe even 2 years. You can see naturally there's no time to even then, by your third year, some people are still even collecting implementation data that there's just no time to then see its full effect over time. So time is a big hurdle that has been, something that I don't even know we have a true clear answer in terms of how to achieve, because if you only follow the grant cycle, the model of 5 years is really not sufficient. The model of 2 years is not sufficient. You want to protract the period of time so that you can initiate, you can implement, and really then have time to study, well, what happens when we go away? Are the effects going to remain over time? We just published this one. There's often no attention to equity. This idea we again approach everything concerning health and in general sustainability from a deficit perspective, right? Forgetting that there are assets within, there's knowledge within that can be championed for change in a resourceful, original way, right? The builds also on the resilience, the memories of people to then champion health over time. And then ultimately no plans to last. And perhaps this is the one that really sits on me oftentimes, because here researchers were given money to do this work. NIH R01 grants, I think the minimum person got at least $1.84 million. And they said, in this group of studies, they actually said they will do sustainability. So imagine, if you wrote your grant and you actually then put in some comment that you're going to do something around sustainability. Well, it turns out that that too is a fallacy. And this was a comment that came out of this paper, that sustainability is something that we researchers rarely think much about. Keep in mind, you said you would do it. So you already wrote a grant that said you would do it. But then in reality, it's like, yeah, we write those grants. We say in the end that we would, publish and lead in journals. The assumption is, well, somebody will do something. And so therein lies the problem, where even some of us come together and say, we're going to do this, we're going to get money to do it. And in the end, again, we don't do. And so the field as a whole still has this fragmentation that often begin. And I think the other thing this paper revealed is that almost none of them had plans to last. And so then, if you keep seeing that over and over, it's like, well, then if somebody has a plan, what is it? And how can we even begin to make sense of it? And so for the past couple of years, we've been doing work for Youth by Youth work, and I'll tell a little bit about it, where, as we were wrapping up with the project, it meant in terms of thinking through its life cycle, one of the things we wanted to do was really, if we were to remain, what would that look like? And how can we then begin to study that over time? And so we come up with planning, again, from, borrowing from Jeffrey Grant, that anybody that's interested in sustaining anything, especially making it simple, you want to gather people, you want to learn, you want to adapt, and you want to nurture, and that should occur throughout the life cycle of your project, not just in your pre-implementation or post-implementation phase. You really want to do that from the beginning, planning. And so I'm going to share some case examples where if you took plan and juxtaposed it around some projects that have lasted for some time, can you see some of its effects over time? So expanded immunization program, some of you may be aware of it, it's big in any global setting that you may work in. And just to give you some insights, it was launched in 1974 by the World Health Organization as a global endeavor to ensure equitable access to life-saving vaccines. And just to see its progression over time, when it was launched, they were only paying attention to 6 vaccines. Some of the highlights where they their goal was immunize all child in the 80s, eradicate smallpox. There were public-private partnerships built over time, Gavi, for example. And then over time, now they've included up to 13 vaccines, the initial 6 plus more, and COVID. So you can see that over time, that things allowed them to progress to ensure that they're achieving their vision of equitable access to life-saving vaccines. It includes programs like the GRIPS program, which just has about 9 strategies, right? From the national team, so thinking of the people from the national team that is going to be on the ground to ensure EIP continues, all the way to community support. Nothing around vaccines can occur in isolation. You sort of need to have all sorts of people in play to be able to do this work over time. And so, they're celebrating 50 years, 50 years of doing this work, of ensuring that universal access to relevant vaccines is available. It includes public-private partners between WHO, Rotary International, CDC is involved, Gavi, Bill and Melinda Gates. They continue to learn, right? They have this robust vaccine supply chain that is critical in allowing the vaccines to reach people in remote areas and extreme temperatures. They've adapted over time. Like I said, from the beginning, they started with 6, and now they're about 13. And RCTs, randomized controlled trials, have been done to look at all the ways you can change sort of things like the immunization cards, right? They've been RCTs to look at if, can we redesign the immunization cards, and will it allow mothers to bring their children to get vaccinated over time? And then the other thing they often do is just really take time to build local assets, right? The local knowledge of healthcare workers, community members, because they feel they are the most valuable in identifying those people that are hard to reach. Another example, probably one of my favorite, is Sesame Street. And if you were paying attention to Twitter early this year, Elmo checked in, asking how is everybody doing. So let me check in too. How is everybody doing? I hope well. And Elmo is as enduring as it can. And if you just look at what they've done over the years, from even more recently in terms of promoting racial justice, making sure children are coping and thriving. I saw Juliet Williams is on the call. Hip hop music, right? You guys have used Sesame Street for the work you do. It's just an enduring platform that really, really connects really a lot of the work we do, from health, to the community. And just again, they too have that sort of breadth of work, right? Where there are people, educators, creators, researchers, moms and dads, everyday people passionate about helping children. They continuously learn over time, and you can see in some of the things they've been doing, whether it's promoting racial justice or helping families cope with the pandemic. They're willing to move, adapt their platform to adjust with the moments they find themselves in. And they're always at, the adaptation. It's in 150 countries, 150 million children having access to early education, critical health lessons. So it's not just one thing and it's done. It's multiple things, that ultimately give joy to children, and then they nurture, the people that they serve over time. Ultimately, their values are mission driven, children focused, with the goal to help children be smarter, stronger, and kind. And that's Sesame Street. It can teach us something, because it continues to exist 55 years later. I also decided to bring it home and just spend some time looking at the Irving Institute CTSA program. You guys are also an example of this in action. The fact that you're 53 years and counting. You can see your people. I mean, this framework more than I do, of wanting to develop, demonstrate, and disseminating knowledge. You can see that over time, how you've done that with core people. How you learn. You really have a learning health system, right? I mean, that's at the core of who you are. You're willing to learn and adapt over time. And you've adapted over time to include multiple public health crises, whether it be opioids or COVID, and you're willing to nurture the communities you bring together, all with this mission of making sure your clinical and translation science work improved health and well-being of communities across the nation and the world. So you already have a plan of how this works, and it's 53 years and counting. And so let me then give you some lessons from Nigeria, where if you're going to come do work in Nigeria, you're beginning from, a point of view where the budget for health, for example, 73.9 million. So there's not a lot of money to really do, health work. And this is from data from 2018. So I could be wrong where people are these days, but from what's publicly available, this is where we are. And then 40% of Nigerians, live on $1.25. 4% have access. So you could already see that, the struggles are going to be hard. There's struggles, there's struggles everywhere, but it's going to be hard to do work in Nigeria, knowing some of these deficits occur. So our project came to really expand HIV self-testing and drawing on the resourcefulness, the originality of young people, and also using contests, right? Crowdsourcing contests and apprenticeship to then work with young people, not as passive recipients of these interventions, but actual partners and leaders. And so after the contest, we moved into a pilot phase where those ideas were then piloted. And then after that was done, we moved into a clinical trial that actually just ended last year. And so this is what that looks like. We start with a contest. You'd submit creative ideas. We take some of the youths to a design-a-thon, which is similar to a hackathon, and they continue to tinker the ideas. We build skills. So all that capacity building, it needs to happen over time. So we build skills with the youth teams and just really make sure that they're well equipped to then roll out these interventions. And then together we work with them to evaluate it. And so just in terms of some of the lessons we've learned across 5 years, you can see from our schematic that we've had different kinds of people work with us, from our youth implementers to our youth ambassadors, all the way to local stakeholders, to the learning we've done, right? Participatory learning communities. I like to bring that up because in the first month of our pilot, especially when we sent out the youth teams, they had zero recruitment, which makes sense, right? Because they've never really done research before. This is the first time, even though we've trained them, they came back and were not able to recruit. And so we started learning, well, what is not working? What is working? And how can we nurture that asset over time? And it changed the way we even do work to ensure that we're always learning every time as we go along. We were willing to adapt, so our grant, for example, never really had a photo verification system in place in terms of how we would get a sense of if young people had tested. These ideas came from young people. So again, we did a contest. Young people gave us ideas. We were like, okay, this sounds interesting. Can we incorporate it into our trial and see what happens? We were able to do that. And the other thing we also did was nurture just existing assets, and nurture existed World AIDS Day event that was naturally happening, nurture just even the guidelines the country had at that time for HIV self-testing, all then with the goal towards, making sure that we can increase uptake of HIV self-testing and ultimately improve that sustainability over time. So what are some lessons learned? For sure, sorry, let me take it back. Our purpose was clear. We were going to be youth-driven and youth-inspired, and we were willing to come together with a group of people, youth implementers, all of them that were, make sure we are really sticking to what we said was our value. And it begins with our name, for example, for youth by youth. I find it interesting that many health researchers don't even think to brand their projects in a way that is memorable and rememberable. And so from the beginning, we were like, this is a for youth by youth project. The logos were designed by young people. We were going to think outside the box with young people, giving you originality and resourcefulness, and it's going to be driven by young people. So we were clear about our values, that it had to be youth-driven, youth-led, and together we would work with young people as partners and leaders of the work we wanted to do. We knew them. We knew what the young people like. We remain one of the few projects that have over 4,400 young people following us on a free tool, Instagram, and so because that's what young people are doing, right? If you know any young person, chances are they're on Instagram or social media. And so it was important that we built things that allowed us to continuously connect with young people, collaborate with them through spaces and mediums that made sense to them. We were willing to learn. Like I said, when we started, things like a photo verification app or USSD code, it was not on our project. It's not even on our grant proposal if I shared it with you. That came from young people. And so we were willing to adapt ourselves and really get their information and put it into our trial so that we study what can happen over time. And then that's what I was trying to say with the adaptation. We also tracked it because real world settings are messier and just unpredictable. And so it's important to watch what you're doing over time. And if you're going to make these adaptations, be thoughtful in that process and sort of track it. And we did with the Frame.is paper, one of the papers we published that watched what we did from the beginning to the end. We also, the paper that I talked about using the unstructured supplementary service data system, we also collected that data and made sense of really those adaptations over time. And then ultimately that we're nurturing the assets, and we paid attention to the fact that there was a guidelines for young persons research in Nigeria. There's also a package around adolescent and youth-friendly health. Before the end of this year, we're going to also release our own guidelines. It basically talks about how we do the work we do with youth-engaged research. And so those are some of the lessons we've learned, that is important to have people to learn, to adapt, and ultimately nurture assets that will drive equity and lead to sort of this positive mindset with the work you want to do, given the context you find yourself in. And so what are some future directions? Ultimately, we believe that plan might be related to, sustained program. When you think about the sustaining the benefits, think about sustaining the capacity and ultimately sustaining the value, however you define it for yourself. And so we want to be able to track and study this over time, measure this over time, continue to look at the role of equity with this over time, timing, and its mechanisms. We're going to pay attention to that, and ultimately also ROI, return of investment studies. And why do this? This is probably one of my favorite quotes: until the lions have their own historians, the history of the hunt will always glorify the hunter. I think sustainability researchers don't have their own historians. And so oftentimes what happens is that people say it's so hard and they leave it at the tail end of the work. Meanwhile, it's really how we realize the vision of excellence in research, realize the vision of really getting to the bottom of some of these intractable health challenges. It's not enough to be one and done if you don't have branding that allows people to remember you over time. And so that's what we're trying to say, that we do need more sustainability lions that are willing to then really track that history and ultimately create that unified agenda Enola Proctor and colleagues talked about, that will let there be a space for sustainable work. So many people made this possible. I just want to thank you.
Amazing. Thank you so much, Juliet. You covered so much. I love how you always bring in such broader examples too. I mean, we didn't get to touch on your work with light, with the dissemination that you're doing in the public, more broadly, but I just want to applaud you
Thank
just
you.
for the way that you have approached this work in such a engaging and meaningful way.